Well, I've worked in the NHS since 1974, so I've got many years of experience. I think technology has benefited patients in so many ways.
Prescriptions have now gone electronic. In the last few years, people can order prescriptions online. They can get it online to a designated pharmacy in any part of the country if they are on holiday.
When I was growing up, there was no such thing like ultrasounds, scans, CT scans, any kind of scan at all. All we had was X-rays.
In the past, people would wait weeks for the X-ray, and it would be a wet film X-ray. It wouldn't be digital as it is now. Similarly, the auto-analyzers that they have within hospitals that can analyse every single bodily fluid are just amazing.
We're now at a stage, certainly in the last 5 years, where we're evolving even more roles within the NHS. So we have clinical pharmacists, physicians associates, we introduce practice nurses, and they started doing things that were more traditionally done in secondary care or the hospital setting, such as taking blood tests. That has now evolved that healthcare assistants are the people taking those samples, and the nurses are doing more long-term condition management that the GPs may have done once upon a time.
So more and more over the last 10-20 years, I think there's been this gradual slow shift towards care being dealt with out in the community, and also in many ways care being shifted out from secondary care services into primary care. Obviously the GP is there for support and help as needed, but largely we can work on our own and deal with lots of minor illness conditions and infections.
For me, one of the big things is to think about the funding and 18-week targets. That revolutionised things, and that suddenly made these things so much better for patients. I can remember when I first started as a GP in the early 90s, people were waiting 2 or more years to have a hip replacement or back surgery and things like that. And they used to have to save up as families to pay for it privately because they couldn't wait that long. We don't like to, be led by targets, but I think that's a target that we need to stick to.
I think one of the things that makes the Cancer Information Hub different from past initiatives is that it's really based solidly in the community in Sheffield. So I think sometimes people find it quite difficult or a little bit daunting to go and talk to their GP about something that they might be worried about. So I think people just come and just talk about what they're going through, and sometimes that's all they need to do and they go away feeling a lot happier. And sometimes we'll give them more information, we'll signpost them to other organisations.
I started my life as a speech and language therapist in the 1980s, the early 1980s, working in learning disability services. People with learning disabilities now live much more ordinary lives, integrated into the communities, living next door to you and I on normal streets all over the city and participating in everyday life in the way that 30 years ago we certainly weren't able to do.
So obviously I can't speak to 70 years of the NHS, but even in my lifetime I think we've seen huge changes for the better, particularly from my point of view in the provision for LGBT plus people. I think there's been huge growth in sexual health services, in education, in understanding of mental health for LGBT plus people, and particularly we've all seen in the past few years the understanding of care for transgender people. I think there's still a long way to go, but I think that's something we can be really proud of, and proud that the NHS has been at the forefront of that.
We work closely with the CCG under the Future in Mind transformation plan, and through this work it's been fantastic to see the way in which the NHS is listening to children and young people, and I really feel like we have an opportunity to influence and to be heard, and the young people have a direct line of communication with people commissioning services.
I think the most important change, and for the better, is that we GPs are now saying to people, instead of saying, what's the matter with you, we are now saying, what matters to you. And that's quite a subtle change, and it changes the dynamics in the consultation.
The NHS is being more patient focused. It's a good thing for the NHS, it's a good thing for the patient, because now the patient is involved with their care and everything that happened.
I think what that does is give you your sense of pride back. You stop becoming just a patient, you stop being the person who just has a disability. You can say, I've got this, I can play football, I go gardening, I made that.
We can do some incredible things, but I remember William Osler said more than 100 years ago, perhaps the father of medicine, that a good physician treats diseases, but a great physician treats the person with the disease. We as GPs, as nurses, as the wider healthcare team are experts in some of the healthcare stuff, the diseases, the technology stuff we've got really clever at, the drugs, the operations, but then the person is the expert in themselves, in their life, in their priorities, in their, what really matters to them. And as a team and a partnership, we're really strong together. So we coach them in the stuff we know, and in a way, they coach us in the stuff they know as well. And that, for me, is a really positive way to look forward to the NHS for the next 70 years.
I think working together is just so hugely important, because what we want to do is develop a more prevention-orientated system which helps people, stops people getting ill in the long term and improves health outcomes for the population as a whole.
In Sheffield, we're working closer and closer together as partners. We are working with our partners in the hospitals, but also practices, and then colleagues in the council, especially in social care and children's services. And of course, we're working with the voluntary sector, with charities and others.
We need to make sure our approach to delivering care is as integrated as possible and really provide seamless care.
I'm optimistic that we're going to be able to work together and hopefully make Sheffield a healthy place to be.
In years past, we used to be competitors. Now, groups of GPs in neighbourhoods and localities are working together, and that's for the best. We need to get the best value out of the NHS pound, and the only way we can do that is to work at scale.
Rather than a practice just looking after their own patients, we're looking at ways that we can do things much better as a bigger group or a bigger organisation. So it might be, for instance, that you can employ a physiotherapist, whereas one practice couldn't afford to do that, but over 4 or 5 practices you can do that sort of thing and provide that extra care.
I've laughed with, cried alongside and consoled many patients and colleagues over the years. But the one thing that has never changed is how proud I am working together as a team, which I feel is the embodiment of NHS working, and will hopefully continue well into the future, and as Buzz like you say, it's from Toy Story to infinity and beyond.